we'll move on to our panel discussion. I invite our panelists, and there are a few questions very important, but as the speakers were very good, the issues of new onset diabetes by Professor Ghosh, and issues of in-hospital management by Professor Bhandari, and also the unholy triangle of COVID-19 diabetes and mucormycosis by Dr. Satya Das was very informative in the session COVID-19 and diabetes, the 5th session of the 8th edition of NUCD 22, and today's last session. So in few minutes we'll be closing the session, and I invite all the panelists for the questions. I think Dr. Das is there, Shujo is there.
Yes, Shujo.
Yeah. Dr. Shuja Ghosh, Dr. Bhandari.
I think we can start asking questions, Jan.
Yeah.
Can I start?
Yeah. We can start, sir. Yeah.
Dr. Satya, your presentation was absolutely fabulous. I liked it. Just wanted to know, to make a long story very short because time is less, we also encountered few cases of what we call white fungus, the aspergillosis, and something of the we call it quote unquote yellow fungus. Did you also encounter them during this pandemic or in your career there because of diabetes or hemato-oncology or other immunocompromised patient? I think you're muted, Dr. Satya.
Yeah, you are not audible, sir. You have to make the device audio. Yeah. You have to make the device audio on. Take out the earplug.
Maybe you are not put your.
Sir, can you remove your earphones and try?
Please take out your earphones, Satya, and try without earphones.
Device audio on. And take out your earphone so that you can speak to your device. That's the best thing.
It's not audible.
Hello.
Yeah, by the time Satya sir is audible, I'm taking another question to Professor Dash. Do you think COVID causes diabetes?
Whom are you asking, me or Satya?
Yeah. Professor Ashok Das.
I strongly believe COVID can cause diabetes in two ways. Number one is that COVID has a direct pancreatopathic effect. And we have seen a couple of cases where the COVID was instrumental in producing pancreatic necrosis, and they developed diabetes and they were on insulin. But you may ask me whether insulin for a long time, as long as they were in the hospital, they were on insulin, so we're following them up. Now they're on BITS therapy, bedtime insulin, daytime sulfonylurea. We have to see how they behave. The second way COVID can produce diabetes, Jayant, is the stress induced. You know, COVID is a terrible stress, the diagnosis itself. So we've seen few cases of hyperglycemia or diabetes induced by the COVID diagnosis and the COVID stress beyond the diabetes, NOD, new onset diabetes, which Satya has so beautifully described because of steroid therapy. So I believe there are three ways one can get new onset diabetes. One is what Satya described, the steroid therapy or whatever. The number two is the direct pancreatopathic effect of the virus, and third, because of the stress-induced diabetes.
Very rightly delineated, sir. Professor Das has edited a full monogram on COVID and diabetes, and then it is so informative. I'm a part of the book.
Yes,
we have contributed a chapter. Yes. I went through, and by the time I had taken and distributed many of my close colleagues, and it's very informative. So, Dr. Das, are you through?
Satya, are you audible now? Just try speak few words.
We are unable to listen you, sir. Stuti, you can help Dr. Satya Das?
Yes, sir. Satya Das, sir. सर आपका जो ऑडियो का आपको एक आपकी स्क्रीन पे नीचे एक बटन दिख रहा होगा आपको फॉर म्यूट एंड अनम्यूट। अगर वो कनेक्टेड नहीं है तो वहां पे आपको एक ऑप्शन भी आएगा कनेक्टिंग कंप्यूटर ऑडियो।
जो हाथ में पकड़े हैं वॉइस, उसमें भी ऑन ऑफ है।
Yeah, it's audible now, sir. You can speak. No.
सर कैन यू जस्ट रिमूव योर ईयरफोन्स? सर आपके ईयरफोन्स है ना, उसको प्लग आउट कर दीजिए आपके लैपटॉप से, उसको लैपटॉप से निकाल दीजिए सर।
You take out the earphone connection to laptop. You have taken from your ears. Now take out from the source, from the laptop. Now you try to speak, sir. You'll be audible.
No, sir, it's not audible. I think the setting.
Okay, I ask one or two questions in relation to what Professor Satya said. That we have seen one or two cases of also published on the name of Dr. Kishku, where he also found aspergillosis. And one case, what they have been described from Chandigarh as white fungus, white mucor, and one case of very severe sepsis with mucormycosis. But lo and behold, with the targeted amphotericin B therapy, he also became all right. And now we give amphotericin B not for the 14, not for 28 days. We give it for about 6 weeks. And we keep them in a room adjacent to the, not adjacent, nearby the hospital. And we give the injection and follow them up. And we have been very, very happy that the turning out has been great. We wrote a lot of articles in the Indian Express, and one such article which I'll focus here, I will just show it here, was on the mucormycosis we found there. And is it visible? Jayant, is it visible?
Not clearly, sir.
So we wrote about that in the second wave of COVID-19, when they ravaged the country, mucormycosis was one of the greatest threats, and we had large number of cases. We did not count the cases, but we said that the opportunistic infection comes from the fungi that we have already discussed, so beautifully described by the Satya. But we also said there are some risk factors. The risk factors, one of the risk factors is emphasized beautifully by Satya, blood sugar control, and indiscriminate use of steroids. You give steroids, Jayant, I know, for 5 days. People give steroid for a very long time, in spite of oxygenation improving. We have brought down the steroid use, and also personal hygiene, because these viruses are there on the wood and also on the zinc. We can you see these pictures also along with that. We said that if you take personal care of not touching this wood and the zinc, and also keeping the mask clean and dry. Many doctors wear masks which cannot describe. Wet, ganda ho gaya hai, and these are the greatest source of mucormycosis. So we in the hospital change mask every day, keeping the mask clean and dry, and ensuring a very, very hygienic surrounding is very important. Last point I would like to say that it progresses very rapidly. I have seen within 1 day infection from the nose to the eyes and to the brain, resulting in a very serious outcome. And nothing can be more serious than death. So it is very important to suspect the diagnosis when the patient comes to you with eye pain or nose pain, sinusitis and fever. And for the prevention, we said that do not start steroids on hearsay's advice. Wait for the doctor's advice. And the importance of following preventive measures are very important. And usually surgery we have performed majority of the cases, both by the ENT and the ophthalmic surgeon, and the results have been rather rewarding. Thank you, Sanjay, for giving the opportunity. Whom to ask question now? Would you like to answer one?
Yeah, Dr. Satya, are you? I think there's another connection.
Yeah. I've just switched on another laptop.
Yeah. So now you are audible, sir.
You're audible beautifully. You know, Saint Bart is the Saint Bartholomew's Hospital is the Makkah of diabetes. You know that all the great scientists of diabetology, type 1 diabetes, Satya, have been trained in Saint Barth. And so it is a fantastic hospital that you are in. I just wanted to know that you said that you had less number of cases compared to India. That is only because of the sheer numbers. In diabetes, COVID, we had sheer numbers very, very higher than the UK numbers. But what type of mucor you saw mostly? This was usually ocular or cerebral or the rhinocerebral. What was the maximum number of cases?
Is the rhino cerebral in terms of the diabetic patients?
Rhino.
Yeah,
Rhino.
in my at St. Bartholomew Hospital, I deal mostly with hemato-oncology, so it tends to be more dominated by pulmonary ones. But we do still see rhino-orbital.
And what has been the outcome with we have you show the capsopungin and all that. We have also found it not very useful. We have used
the caspofungin doesn't have any activity at all against mucormycosis. As I said, there's a big problem. Is that the big problem is that it's limited number of drugs.
Yeah,
and in effect,
we mostly used the amphotericin B, the liposomal form, and we give it for a very long time. We do not stop within a short duration of therapy. What has been your experience of therapy?
Well, unfortunately, I've not seen one in the context of COVID-19 because that's in one of our sister hospital. But in terms of mucormycosis in our sister hospital, I think we've only had about 2 or 3 cases.
We used, along with other drugs, we used the posaconazole in few patients, the oral posaconazole.
There is, I know sometimes people use combination, but there is no evidence at all that combination is more effective than monotherapy with ambisome. And obviously, it's in a very rare disease like
itraconazole.
Sorry.
Itraconazole.
Itraconazole is more often posaconazole. Itraconazole is not as good as posaconazole or isobutanol. So we tend to use only, if we can't use ambisome because of adverse drug reaction or any other factor, then renal function, for example, then we tend to use isobutanol as our second choice, with posaconazole as a third choice.
Yeah.
But these are significantly less potent than ambisome.
Yeah. Actually, our SCB experience, we have treated more than 200 patients. And as Professor Das told, mostly people required surgery. And initially, the blood glucose control was a challenge. And we primarily gave lyophilized amphotericin along with posaconazole to good number of patients. But along with medications, along with diabetes control, surgery was required because we also had highest number of rhino-orbito-cerebral mucormycosis, more than GI, more than pulmonary. We had that. And then
have you analyzed the cases, Jan? Was it because of indiscriminate use of steroids beyond 5 days?
Yeah, multiple factors we found, sir. Mostly these patients stayed in ICU for long, at least 2 to 3 weeks. They got high dose of steroid for longer time in the interest of saving their respiratory function and the lungs. And another thing, as already have pointed out, the dirty habits, the dirty masks, and the contamination and the high dose of zinc and the contamination part, and also factors like poor control of diabetes, they contributed towards this ubiquitous fungus. It's a opportunistic fungus.
This exists everywhere.
Yeah, exists everywhere. So only thing in this immunocompromised patient, it took a very severe form and many lost life because it was potentially dangerous. People presenting with headache and blackish discharge from the nose with the doses.
That's what I said, that what we wrote in the Indian Express article for the common people, that in a case where the COVID or post-COVID, any eye pain, ear pain, sinus pain, don't take it lightly. Go to a doctor to have a look whether it can be because of that. I want to ask one question to Dr. Satya. The mucoral family that you described, the mucoral family to which this organism belongs. Speaking microbiologically, what is their spectrum of illness they produce, and are they becoming rarer and rarer or becoming stronger and stronger?
No, I think they're not more common or rare or at all, because they're part of our environment. and so I think where, if there is a lot of changes to the environment, for example, there's a lot of building constructions going on, which generate a lot of dust. And they're the situations where much more likely to disseminate the organism, and the human contact will be much more. And as I said, if you're a healthy individual, it doesn't cause disease in most healthy individuals. There has to be a defect in terms of immunity, in terms of problems with blood glucose and diabetes patients and immunocompromised patients. It's really it's a very common organism. The disease is rare, but the organism is very common in our environment. I think it just tells you how good a normal immune system is at coping with these organisms.
Great.
We come
that is
come
God's
with it
gift.
every day.
Yeah, that is
not
amazing.
all of us die from. Not
Amazing.
all of us get the disease.
Amazing. And also how true it is, Satya, that when we find a infection specific to a particular condition, a diabetic which comes with a black discharge from the nose is nothing but rhinocerebral mucormycosis. A diabetic which comes with a big eye, you showed those pictures, big eye or the perforation of the palate. I do realize you are an ID specialist, Professor Satyadas. I have found that there are some infections which are specific to diabetes, as under specific to type 2 diabetes, type 1 diabetes. Type 2 diabetes carbuncle is a type 2 diabetes phenomenon in my mind. I'm not seen in type 1. Similarly, the COVID, the mucormycosis in diabetics is extremely common. And COVID, common in the sense, if you get a black discharge, if you're getting eye swelling, if you're getting a nasal sinus problem, if you've got severe headache with some neurodeficit, it is nothing but rhinocerebral mucormycosis. It's a specific infection. And that helps the clinician. That also helps you, Dr. Satya, in arriving at a diagnosis and guiding us how to treat. Am I correct?
Well, I think the diagnosis is a challenge. I think even more challenge for us because we don't see many cases. I think that's why I think it is a golden opportunity really to advance knowledge about the subject. And I think that India is best placed for that because
we have seen hundreds of patients. I
think what's important is that you write up your experience. You're talking about the drug.
My good friend, Professor Jyotirma Pal in Bengal has written a monogram on mucormycosis. I'll forward that to you. I'll collect your number from Dr. Alok Kanungo.
And also soft copy. Soft copy is also very good.
I'll send the soft copy. And we have described more than 200 patients there. Exposure is very high here, as you know, as usual in every segment. But the scientific documentation part has to be done carefully.
I think we'll stop here, and we wish to thank Dr. Satya you profusely for being.
Thanks very much for inviting me.
And it must be 7 o'clock, 6:30 there evening, Satya.
4/5.
Yes,
I was for a couple of years in King's.
It's 4
hospital.
4/5/17 p.m.
6/17. So great country. And great institute you are in. We used to call St. Bart as the Makkah. King's College was not that good that time. I'm talking about 1990 beginning. And so hats off to you for your great work, great interest in the subject and keeping India, bringing India pride. And please come back year after year to join us and to enlighten us.
Thank you very much. But in fact, next year, which will be in 2 years' time, next year, 2023, St. Bartholomew Hospital will be celebrating its 900th anniversary. So this is the oldest hospital in the UK.
It's an epic hospital, Alok and Jayant. It is something like a pilgrimage to go to the hospital. In between, the NHS decided not to open. Remember that time about few years back, they said St. Bart will not admit few cases. They became a bit restrictive. Am I correct? Restrictive. They became a little restrictive. Not now, about 10, 12 years back from today. They said that they had cut down the number of positions and people had to leave St. Bart to go to Bristol.
I don't know. That is because there was a big merger of many hospitals and medical schools in London in the 1990s.
Yeah, exactly. I'm referring to that. But it has come back. 900 years is rare. And also, me, Jayant and Alok are alumni of a college which is oldest in our country, along with Calcutta and Madras Medical College. You know it, SCB, one of the oldest colleges, but not yet 900 years. Thank you very much, and come back again and again and again.
Thanks a lot.
We really enjoyed your talk. Thank you very much.
So we had a very successful session, COVID-19 and diabetes. I thank all the speakers, Dr. Sujay Ghosh, Dr. Sudhir Bhandari, and Dr. Satya Das, and our moderator, Dr. Sunil Kota, and Professor Ashok Das for mentoring the whole session. And the topics were very interesting: the new onset diabetes and inpatient management, as well as mucormycosis, diabetes, and COVID-19. And the special discussion on COVID-19 with Dr. Satya Das was very informative, and we got a global picture in it. I thank all the speakers, moderators, the chairpersons on behalf of the scientific committee. And with this, we close today's scientific program.
1 minute, Jayant, 1 minute. I'll just summarize today's program because I believe in...
I'll hand over it to you, sir. Day one headlines roundup.
I'll just take the headline roundup. We started absolutely dot on time, 1.05. That was decision by Alok. And we had a wonderful inauguration. The beauty of the inauguration was, Alok, that everybody spoke so beautifully from their heart. That was a great thing you introduced this year. I liked it profusely. And then we had the oration for Professor R.J. Dash. And I must tell you that I hold him in high esteem. And after the oration was over, I got 5 letters, one from Arpan Dev, one from S. Murthy, one from another student called Sanjeevi, again Sanjeevi, and 2 more. They wrote to us, sir, please forward the lecture to us. We want to introduce it in the ESI and RSSDI. So Alok, we are the first to introduce the oration. So great glory to us. I will write to Madam tomorrow. The second session was on the nutrition. Fabulous session. You know, Dharini made a wonderful presentation. Cheryl was absolutely great. And Dr. Sharma, he talked about the reversal of diabetes in 3 ways. Bariatric surgery is only one way. He talked about the carbohydrate restriction, both total and intermittent, and told about the low carbohydrate diet, referred to direct study. And, I was just about to ask him, even the new drug which is introduced in the country, like weight reducing drug like Rybelsus, the oral semaglutide, or they also can produce a great reduction or remission of diabetes, because they also reduce. Pioneer 8 has shown that the weight reduction is quite great. But it was a great session, and I like the way the panel discussion was held by Dr. Kanwar. What oil you should use, how much you should use, and what food to take, in what form, what rice to take, how to take potato smashed or whole potato. Both are bad, but which is worse? It was a great session. Then we had a session on the technology. Again, great session. And with the beauty of the session, the faculty are great. Fantastic session. Then we had the session on the oral antidiabetics, and I think the session was good. And I must also tell you the panel discussion which Sanjay conducted was by molecule by molecules. I congratulate you, Sanjay Jain. Don't be in a hurry to go home, but you are in home only. So, you did molecule by molecule. Started with metformin, sulfonylurea, DPP4, SGLT2, molecule by molecule.
My dinner has reached just. After I finish, I'll have dinner.
I'm finishing soon.
Dinner by kids.
4th session was diving deep into insulin. I really enjoyed the session, and the question answer also was very good. I hope people have enjoyed the question answer on the 3 aspects, both on the oral semaglutide and also the TIR, which was part of the talk, and that Dr. Manas spoke, and also main focus on the insulin. And the last session is on the last session was on the COVID-19 and diabetes. And Sujay was fabulous. Dr. Satya was great. And Sudhir's interview was also great. Thank you, Alok, for doing the interview. And in spite of the time constraint, we had a beautiful discussion and discussed threadbare the various aspects. Dear friends, the people who have joined, I must tell you that tomorrow we're starting at 11. It will be 11 to 11:05. The session will start, and we have for you lined up the program, which is centered around great things. It is centered around the complications in 2 sessions. Diabetes disease of complications, session 1 and session 2. We also have a session on the clinical pulse in diabetes care. We have the latest about type 1 diabetes. We have Dr. Sanjeevi and Sanjeevi's boss, Dr. Lenmark, who discovered the autoantibodies, GAD and ICA, and we have Dr. Sharda. We have a session on the diabetes and the mental health, very important, and we have a independent lecture series at the end by Sunil, Sambit, and Subankar. I invite you to join tomorrow before 11 o'clock. Over to Alok to close it with his closing remarks.
Thank you, Professor Das. Thank you, Dr. Satya and Jayant and all the members, Devasis and everybody who are present. And it was a really great academic exercise and a lot was contributed. Thank you very much.
Thank you.
And
Thank
we will
you very
meet
much.
tomorrow
Bye-bye.
at 11. Tomorrow at 11.
Surely. Bye-bye. Good night. Good night.
Good night.
Subharatri.
Recording stopped.
So should
No.